Let's discuss the inferior view of the scalp. So first of all, we have the antero-inferior part. So here you can see that the antero-inferior part is going to form the hard palate, and this will include the formation of the palatine bones and the palatal processes. Then in the midline, you can see here this is the incisive foramen, and posterolaterally we have the greater and lesser palatal foramen here. And then we have the styloid processes. Here you can see the two spiny projections, this and this. Okay, so they will go downwards and forwards from the inferior aspect. So above the posterior edge of the hard palate, we are going to see coni. This is a coni, which is a posterior nasal aperture. So the posterior nasal apertures, they are separated with the help of the vomer, which is right here, and also the medial pterygoid. And the inferior end of the medial pterygoid is going to form medial hamulus, which is right here. This is the lateral pterygoid. Lateral to the lateral part of the lateral pterygoid is going to be pierced by the foramen ovale and the foramen spinosum. Okay, so foramen ovale and foramen spinosum जो है यहाँ पर pierce करेगी, and behind the spine of the sphenoid. So this is basically the spine of the sphenoid. Behind this, the auditory tube groove is present between the spine of the sphenoid and the petrous part of the temporal bone. So we are going to see the auditory tube groove here. Behind the spine of the spinosum, the auditory tube groove is going to be present. This is going to form the bony part of the tube. The groove is going to form the bony part of the tube. The upper articular surface of the temporomandibular joint is going to be formed by the articular tubercle and the mandibular fossa. So you can remember this by AM, articular tubercle for A, and M for mandibular fossa. Next, we have the squamotympanic fissure. So this is a fissure which is going to separate the mandibular fossa and the tympanic plate posteriorly. What is the significance of the squamotympanic fissure? Coda tympanic nerve will exit through the medial end of the squamotympanic fissure. Okay, now let's talk about the inferior surface of the petrous part of the temporal bone. So the inferior surface of the petrous part of the temporal bone is going to form the carotid canal. So this is the carotid canal here. Okay, now let's talk about the foramen lacrum. So how can you remember the foramen lacrum? You can remember it with the help of GPO. So G for greater wing of the sphenoid spine, and P for the petrous part of the temporal bone, and O is for the occipital bone. So if I show you the foramen lacrum here, this is basically the foramen lacrum, and it is mostly closed in humans with the help of fibrous tissue. I straighten up the skull. So here you can see the tympanic area. Somewhere near you will be able to see the tympanic plate, and the tympanic plate is basically a C-shaped structure. It forms the bony part of the external auditory meatus. So you should be able to identify the suprameatal crest, the spine, and also the suprameatal triangle. Let's discuss the stylomastoid foramen. It is present between the styloid process and also the mastoid. This is the stylomastoid foramen. What do we have medial to the styloid process? We are going to see the petrous part of the temporal bone, and it is going to have a deep notch. You can see the jug-like things here. These are the jugular foramen. Pharyngeal tubercle is present right here. It is a small midline prominence. And on this is the foramen magnum. On either side of the foramen magnum, we are going to see the occipital condyles, which are right here. And superior to the occipital condyles, there is going to be the hypoglossal canal, which is right here. So hypoglossal nerve is transmitted through the hypoglossal canal. Occipital condyles are going to articulate with the atlas. Here you can see the external occipital protuberance along with the superior nuchal lines.